I'm Dr. Rick Greene, a member of the 1970 class at the University of Virginia School of Medicine, and it's my great pleasure to host a series sponsored by the Medical Alumni Association, which really honors our professors here at the university. And it's my great pleasure to be talking today to Dr. George Beller. George, welcome.
Well, it's my pleasure, Rick.
And I'm excited because I know this is your 50th reunion year.
That's right.
So as we have this 50th reunion this weekend,
Exactly.
give me some of your thoughts, maybe some of the emotions shared looking at 50 years ago, because you came, I think, from Dartmouth as an undergraduate.
That's right.
You came here as a medical student. Why did you come here as a medical student?
Well, it was very interesting. I originally was going to be going back to New York City to medical school where I grew up. And I was asked to be on a faculty student committee at Dartmouth to look into introducing an honor system at Dartmouth. And we knew that schools like, Princeton, UVA, West Point had really established honor systems. So I was assigned to find out more about the honor system at UVA. And then one of the faculty members from UVA came up to the medical school, came to Dartmouth where you could sign up for an interview for medical school. So I went there and signed up, and the first thing I said when I went into the interview was that I really wasn't really interested in going to UVA to medical school, but I saw you had an opening, and would you mind if I talked to you about the honor system? And I remember he was on the faculty in OBGYN, I'm blanking on his name right now. And then after he told me all about the honor system, he said, "Do you like going to Dartmouth from New York?" I said, "I love it. I love the outdoors. I like skiing. I like nature." And then he said, "Well, have you ever been to Charlottesville?" And I said, "No." He said, "Well, why don't you come on down? I think we may have some openings still in the class." So to make a long story short, I said, "Okay," and I can look at the honor system when and working. I came down, I was hooked. It was a beautiful spring day, and I sent in my application, got accepted, and then decided to come here and forfeited my deposit in New York in Albert Einstein.
What a great story. What a great story. So as the honor system really was the hook initially that brought you here. So you graduated in '66. You left. You went back north.
Yeah, I went to Wisconsin for 2 years.
Right.
And then I was influenced there by a faculty member. His name was Bob Donaldson, who knew I started to get interested in academic medicine and research. And while I was at medical school, I worked in the surgical cardiac surgery lab, working with Stan Nolan and other people here, and Frank Damon and Harry Muller. And I really enjoyed that research I did in 2 summers in a row. And then this physician who is an attending on the ward said, "Well, I just got recruited to go to Boston to be chief of gastroenterology at BU." I said, "Would you like to come with me and finish your residency in Boston, because I think you have a better chance of getting into academic cardiology if you do that. And I'll speak to Arnold Relman, who at that time chairman of the Department of Medicine there before you went to Penn and then New England Journal." And sure enough, I was just lucky. There was a slot open. I finished my senior residency at Boston City Hospital, and then I switched over to the Harvard Medical Service, where I did a year of fellowship. Then I was on the Berry plan, so I had to go in the Army for 3 years. But then all I did was head the other direction from Boston to Natick, Massachusetts. I spent 3 years in the Army there doing research at the U.S. Army Institute of Environmental Medicine. Again, cardiovascular physiology at high altitude, heat stroke, things like that. And then when I finished, I went back to Boston, to finish my fellowship at the Massachusetts General Hospital. And then that was my first job. I stayed there as an instructor and then assistant professor in the cardiac unit. But I was very much influenced during my first year of fellowship at Boston City Hospital with a study on digitalis, which was my first research area. And that was done in combination with cardiology researchers at Mass General. I was at Boston City. So when I finished my Army time, the folks at Mass General said, well, why don't you come over here and finish your residency? So I've been very lucky in my, fortuitous positions, that I was able to get.
Well, it's interesting. It shows you what serendipity really does to people's career.
Oh.
I was a burial planner in the Navy. We shared some of those, that history. Certainly, I know the influence of military sometimes. I'm interested with the influence of Harry Muller and Stan Nolan. You didn't go into surgery. Why didn't you feel like you could transition into cardiac surgery at the time? It was sort of fascinating.
Well, I think I always knew that I was more interested in the physiology of the heart.
Right.
Than I was in surgery and understanding, coronary disease, valvular disease. As soon as I took cardiac physiology in I believe it was in the second semester of our first year of medical school, I was just hooked. So Frank Damon was actually a pediatric cardiologist, and he had the greatest influence on me. He worked with Harry Muller. They came here together to start the cardiac surgical program. But Frank was a cardiologist, and he was very interested in hemodynamic monitoring. He started one of the first cardiac surgical ICUs in the country, specifically for cardiac patients. But what was interesting, so when I was in Boston, and my research really began to get into imaging and nuclear cardiology. So that was somewhat technical too, not surgery, but it was requiring a technical expertise.
Well, it's a fascinating area. Now, of course, you spent your academic life in imaging, nuclear cardiology. What's the next threshold in that? What going forward? What do you see happening in that particular specialty area?
Well, I was very fortunate when I was at Mass General, and then when I came back to UVA as chief of cardiology in 1977, which was also fortuitous. I was ready to stay in Boston the rest of my life, and I got a call from Ed Hook, the chairman of medicine. He said, the search committee has been meeting, and would you like to be a candidate to come to be chief of cardiology? And I said, well, Ed, I'm only an assistant professor. So he said, oh, that's no problem. We'll just skip a rank and you can come as a professor. We even have a chair. So that really attracted me. I said, really, a chair and a full professorship? I was only 36 at the time. And, so Ed said, well, listen, why don't I fly up to Boston? I have to be up there anyway. We'll meet in the Countway Library, which was the Boston Library, and I'll tell you all about my vision for building cardiology at UVA. So when I came back here in '77, one of the parts of my package was that cardiology and radiology together would work together in imaging. All over the country there were turf battles between the two specialties. But at UVA, we were one of the first again in the country to have really cooperation between radiology, cardiology, and cardiac imaging. And so I came here with a physicist who I knew from the University of Miami, and together we started nuclear cardiology. And the field has grown. It's gone into PET imaging, very sophisticated cardiac imaging, with stress testing. But there are competing new technologies like CT scanning of the heart, cardiac MRI, and so there's this whole new area that I became involved in also at UVA toward the end of my full-time career, which was called multimodality imaging. So we developed echo, ultrasound, cardiac MRI, cardiac computed tomography, and nuclear, and sometimes using what's called hybrid imaging, where you combine two of the techniques.
You've also been involved in many organizations, of course, dealing with American Heart Association, American College of Cardiology, things like this. One of the things that concerns me about students today, they don't tend to gravitate to organizational life like we did in our generation. Why do you think that's true, or what can we do to stimulate that?
Well, that's a very good point. One of the goals, I was very, very fortunate to be able to get involved with the American College of Cardiology and the Heart Association. And, even during my year in 2001, I was president of the American College of Cardiology. And at that time, we recognized several things, that we needed to have more women in leadership positions in the societies of medicine and the American Heart, American College. But also, we needed to attract young people to come in, and so what we did, I think, virtually all of the committees, we made it a point to appoint some very young people, like just out of fellowship, and then they would be mentored and nurtured into leadership. And so I think that today, though, most of the physicians are so busy with their practice or their academic career. There's so much paperwork and electronic record, and many more patients, sicker patients. And I wonder if perhaps they don't even have time to volunteer to go off to meetings, in California or Chicago for these larger meetings. So I think what I've noticed is many young people gravitate more to develop leadership roles in their subspecialty societies, like the Heart Rhythm Society, or rather than in the broader American Heart, American College. So
at this point in your career, what do you like to do outside of medicine? What gives you a thrill?
Well, it's been I've been very fortunate, as I mentioned to you, Rick. I was chief of cardiology for 28 years at UVA, and then I was able to just be a professor for about 5 years, and go back to doing a lot more teaching and seeing patients. But once I retired, I went back to do just some part-time research and teaching, but no clinical care. But now I've been able to develop a new passion, and that is in photography and nature and wildlife, digital photography. And it's like going back to school.
Are you doing your own developing, the technical part of it, or just the picture taking?
No, I've learned how to use the various, Lightroom and Photoshop and develop. And I have, again, some like I did, 50 years ago. I have mentors, local photographers in the community, and out west in Jackson Hole, where we live about 3 months a year, people who can teach me a lot of the technical parts. And I look at videos on YouTube on how to use cameras and use the computer to process images. So it's been fun.
So this does involve some traveling, or traveling involved with your photography work. I mean, you enjoy that?
Yes, I really enjoyed it. I've gone to Iceland, Patagonia, some of the national parks on these photography workshops. And I'm now just setting up a website, and hopefully have a show in a year or so.
Oh, marvelous. We've been talking with Dr. George Beller today, a wonderful professor of cardiology, former chair of cardiovascular medicine, and a real academic leader in nuclear cardiology in this country and around the world, and who's having his 50th reunion year this weekend at UVA. George, it's such a pleasure to talk with you.
Thank you very much.
Thank you for meeting with us.
Thanks for inviting me and allowing me to share some of my past experiences.
Thank you so much.
It's been a pleasure.